So good morning. We are here in August in the hot weather of Madrid with our fellow Salvatore Vella from Sicily, Italy.
Good morning.
Good morning, Salvatore. How are you doing?
I'm good, thank you.
So it's been now a month and a half. We're just about to finish your experience.
Yes.
And as I'm used to do with all the fellows, we like to hear from their sheer voice, their experience. So how was everything?
First of all, I would like to thank you for the opportunity to stay here with you in Madrid.
My pleasure.
And it has been an honor for me working with you and your team. During this 6 week here outside the operating room, Madrid provided a really nice backdrop for my training. But professionally speaking, working closely with you, it has been extremely good for me because my experience about aesthetic surgery is really good. And surgically speaking, the most interesting part of my training was in-depth exposure to rhinoplasty, secondary case, ethnic nose, or preservation rhinoplasty. Before this fellowship, I didn't have this knowledge about preservation rhinoplasty, but your expert guidance guided me to improve my surgical skill and knowledge about anatomy nose or tips and advantages of technique. On the other end, we have done many types of surgery.
Yes, we did.
Not only rhinoplasty,
No.
breast surgery, body contouring, or facelift. And each procedure gave me an opportunity to learn new techniques and improve my surgical skills, And the variety, I believe that the variety of procedure allow me to gain a global perspective about aesthetic surgery. So I really thank you once again.
It was a lucky period for you because we had surgery every day from Monday to Friday, also on Tuesdays, and which usually is our free day, but we have a lot of people, mainly rhinoplasty. And again, you had the chance to see very different rhinoplasties.
Yeah.
And at the end of the day, it's all about tip and tricks. You have to see different surgeons to see how to do the liposuction of the abdomen, how to do the lipofilling, how to choose whether to do a rhinoplasty in a preservation or a hybrid way. I'm happy that I could give you my perspective, my view about the topic, but obviously many other colleagues will complete your training as well. And also, you spent a lot of time, you were some of the most punctual fellow, being here every day, no matter what, with all the patients in the consulting room. Guys, I always repeat that staying in the consultation room sometimes is not that challenging or exciting like in the operating room, but you learn a lot about how to deal with the patient, how to organize the marketing tips, and how to communicate with your patient. So you also had a background, a complete view from when the patient comes, how we treat them to convince them to get the operation, and then the surgery and the post-op. You see the full picture.
Yes, it's not only surgical fellowship.
No, it's a whole comprehensive fellowship. Salvatore, thank you for sharing your experience with all the others, because I'm sure that people will get advantage of your experience. And we're going to meet again in October at an Italian national meeting in Sicily.
Yes, obviously, yeah.
Okay, thank you very much.
Marco.
Okay, we still have 2 days of surgery before holidays. Ciao.